This is Video Journal Unit 6. It is about an experience that I just had last clinical, which was yesterday. My patient was a 14-year-old girl who had major depressive disorder, severe, recurrent, also had an episode of suicidal attempt by overdose about 3 months ago, for which she was admitted inpatient. She also had anxiety disorder as well as oppositional defiant disorder. Her presentation to the clinic was very much classic of oppositional defiance. She refused to engage in the interview, in the assessment. She refused to answer any of the questions definitively, describe her symptoms to us. She just would not allow any information to any of our questions. Most of her answers was pretty much, I guess. She was definitely irritable from what we could assess from her mood. Because she would, of course, she was acknowledged us as a provider, so she would always turn her anger towards her mother in the form of argument, defying her questioning, defying her information that her mother was trying to give us. Negating those things, just overall being absolutely not helpful in the process of trying to get her any help. She was also discontinued her medications, which are trazodone and Prozac, which were prescribed to her, and she refused to engage in her therapy as we could get from the therapist's notes. So it was not going well for us. Our plan was to put her back on an antidepressant because she was definitely displaying symptoms of hypersomnolence, as well as anhedonia. She had no interest in school. Her grades were falling. She was mostly D's and F's. She wanted to sleep all day. Her mother was also enabling the behavior. She would let her go to school late, so she would just go to school whenever she felt like. She had no social life, and she had no interest in any hobbies, did not participate in any sports, and of course was absolutely falling behind in terms of assignments at school. So additionally, the patient just threw at us that she probably thinks she has ADHD and she should be prescribed Adderall. So obviously, it kind of gave us a hint that she was probably seeking some kinds of substances, although she denied it. So we ordered a UDS on her, and then there came a little bit of counseling session. We kind of took on the roles of counselors to tell her the importance of medication compliance, how it can help her mood, and how we are here to help her. So we kind of took on the roles of friends rather than providers at that moment. And slowly we did notice that she was beginning to understand our point of view, as her stance from being absolutely defiant to kind of like being a little bit more agreeable. She was shifting her stance to being more agreeable. So eventually we decided to put her on Zoloft, and then we had the therapist contacted to get her weekly therapy sessions, as well as getting the next appointment a lot sooner than the typical 6 to 8 weeks. So her next appointment was in 4 weeks, just to kind of keep a close eye on how she was doing, considering her history of depression and overdose suicidal ideations. Thank you.